Recording now, yeah.
Thanks for tuning in. So this is a series of videos on runners' injuries. And the first one is on metatarsal stress fractures. So I'm Matthew Welck, consultant foot and ankle surgeon from Orthopaedic.
I'm Nick Cullen, consultant orthopaedic foot and ankle surgeon from the Royal National Orthopaedic Hospital.
I'm Mehrdad Shamali. I'm an MSK physiotherapist from MSK Physiotherapy London.
So the structure of this is a 10-minute short video of which we're going to start, and it's going to be an overview of metatarsal stress fractures for 5 minutes. So what causes the stress fractures? What does it feel like to have a stress fracture? How is a stress fracture diagnosed? How are they managed? And then what can you expect if you've been diagnosed with a stress fracture? And then there's going to be 5 minutes from Mehrdad, who's going to talk about the rehab. He's going to talk about exercises and rehab you can do during the different phases of your recovery. And if you go through these, it will help speed up and improve the quality of your recovery. So if this is of particular relevance at the moment. So during the COVID-19 lockdown, we found that the most sedentary people who are not used to walking have been going out and doing their half an hour or an hour walking every day. So they've been doing lots of unaccustomed exercise. And the most active people in the population have changed their exercise to outdoor running based on the fact that all the gyms are closed and that sort of thing. So we have seen a massively increased incidence of metatarsal stress fractures due to these at this particular time. So what is a metatarsal stress fracture? So they're otherwise known as march fractures because of army recruits marching having a high incidence of these fractures. And what they are, as you can see in the picture, is they're a crack in the metatarsal bone that happens due to increased stress. The second and the third, which you can see from the pointer, tend to be affected more than the fourth and the fifth, which is good news because the second and the third tend to heal better. The fourth and the fifth are more likely to not heal. And the reason it affects the second and the third the most is because they are the stiffest of the metatarsals. Also, that the fractures tend to be in the shaft, which is this point here, or the neck, more so than at the base. And again, that's good news because the ones further down tend to heal easier than the ones at the base. So why do metatarsal stress fractures happen? And essentially what's happening is there's damage to the bone without enough time for the bone to heal. And that can happen by two main mechanisms. Either bone fatigue, and in that example, you've got a normal bone with excess demand put on it and not enough time to repair. And the other mechanism is bone insufficiency, where you've got abnormal or weakened bone, which has a normal demand placed on it. Now, my colleague here has a ruler. And you can see, I don't know if you can see, but if you bend the ruler, which is acting as a bone, there'll be an area of increased stress that you're all familiar with. And if you keep doing that, ultimately, due to the stress in the bone or the ruler, it will break. And that's very similar to the mechanism that happens with a stress fracture.
So moving on to who these stress fractures affect. It's surprising sometimes that stress fractures happen in busy people. It's often difficult to work out what you've done that causes the stress fracture. And it can be something as simple as a slight increase in activity or a walk on different surfaces, a change in footwear. The majority of people that we see these in are the higher impact athletes, like the runners and jumpers, and it's quite common in dancers as well. And as Matt said, in the people who've unaccustomed to do a certain level of exercise, which is why we're seeing this happen so much over the COVID crisis. So an increase in the frequency of the exercise, of the length of time that you're doing your exercise for, what you're exercising in terms of your footwear, and whether your footwear is due a good change. People who do a lot of exercise or do a lot of walking in high heels cause much more stress through the front of the foot. And there are a certain group of people that we call the female athletic triad who do a lot of exercise. There may be a degree of hormonal imbalance. It's difficult to get the nutritional balance quite right. And sometimes this leads to a lower bone density, which makes you much more prone to having stress fractures. So how do they present? Well, as we've said, these tend to present in busy people. And it's strange that sometimes the stress fractures don't present immediately after you finish a walk or a run. And patients will often describe that the pain comes on the day after this. So they wake up with pain the morning after they've done a lot of exercise the day before. The pain's often reasonably well localized, and it becomes more so as the stress fracture develops. And patients with metatarsal stress fractures will often complain of pain at the top of the foot or at the ball of the foot. And it's much worse when they're weight bearing and walking. They'll find it's really tender to press on the spot where the fracture is. And this is a patient who's circled exactly where their pain is. They've got swelling here and they're very tender to touch in this circle. So what about investigations? Well, very often the diagnosis is quite clear from the story. And we see a lot of patients who present to have an X-ray at the accident and emergency department, and they'll be told that this is just a soft tissue injury, because to start off with, for quite a few weeks, there's nothing to be seen on the X-rays at all. So most of the time with an early stress fracture that's presenting, you won't see anything on an X-ray. And even a CT scan, if the bone hasn't broken, and we looked at the cloudy ruler here before, then the CT scan will be normal. So the most accurate way of diagnosing this is an MRI scan or a bone scan, which will show up quite brightly where the stress fracture is. And we've got an MRI scan just down at the bottom right here, and we can see that the normal bone, which is quite dark grey on these images, is bright white and it's lit up. The X-rays are absolutely normal in this area, but this is bright and it shows where the stress fracture is.
And just to point out that that MRI is of the same patient that's the picture of next door, so the pain is quite well localized to where the stress is.
And the top right picture here is just someone, this is someone who's a bit further down the line, and they're 4 or 5 weeks down the line, and we can see that there's a little fluff of bone there where they're starting to heal up that fracture. But that's much further down the line. So how do we treat these? Well, we've said stress fractures happen in busy people, and we have to reduce the amount of time that they're busy for. So we need to reduce the time of stress in the foot. And that can be quite difficult when you're running around doing lots of things. It's surprising how many steps we can build up just doing our normal daily life. So it often helps to have a weight-bearing boot, which takes the stress off the foot, but allows you to do some activity, but it doesn't give you a free rein to do all the exercise you want. You still need to reduce the amount of steps you're doing per day. It's important while you're in the boot to exercise the foot, and Mehrdad will talk a lot about how to exercise and maximize your ability to maintain your muscle strength and balance while you're immobilized. Once the stress fracture's healing up, we have to think about reintroducing our normal exercise and sport. And it's not a case of pulling your boot off at 6 weeks and just getting on with things. You have to think about wearing cushioned footwear, exercising on softer, flatter ground to start off with, lowering the intensity of your exercise and planning your return to sport. Rarely we need to operate on these stress fractures. And Matt's already talked about the stress fractures happening at the bottom of the bone. And some of these are prone to not healing up. So rarely, if the fractures aren't healing up, we'll need to do an operation where we fix the bone with a plate or screws and some bone graft. So I'd like to hand over to you, Mehrdad, to talk about the rehabilitation of stress fractures.
Thank you for the introduction. That was really helpful. What I'm going to do now is take you through the rehab process like discussed. So here we've got an overview of the goals. It's very important to work collaboratively with the consultant and the physiotherapist, just to ensure that we establish certain limits and boundaries so we know when to increase an exercise activity or when to reduce how much we do. It's also important to note that the stages will interlink. You might have to take a step back, and also you can take a step forward sometimes based on your pain levels and how you're getting on. Exercises that we're going to go through will require trial and error. Sometimes you might be able to do more than you can. Sometimes you might need to, again, make it a lot easier, even though they might be boring or you feel like you're regressing. It's really important to make sure we keep playing around with how much we do. So here we've got some range of motion exercises. You can perform these basically drawing shapes, writing letters, numbers, moving your ankle around in all sorts of directions. You might want to start off with going up and down first and then going side to side, again, as pain allows. These will help increase mobility and decrease stiffness. We'll go on to some weight transferring exercises. These are important to help us improve our coordination and also start to learn some more precise movements. These can be performed seated and standing, again, depending on how much you can do at the time, with or without the boot, shifting to the side, forwards and backwards, even diagonal as well. Then we've got some stepping practice. This is really important to help the client regain their stepping ability. So we're going to go forwards, backwards first, again, to start off very easy, then sideways, and then doing either a clock or go into different directions to make it more challenging for the foot and ankle. We've got the next slide here. We've got some sliders. These are quite challenging as they're really good to help engage your grip strength and also improve your control of the foot and ankle. As you can see on the video on the left, you can do these seated, again, if they're quite tricky at the beginning, and move to holding something against the wall and not letting it fall, because that will make it a lot harder for your foot and ankle to work. So following an injury, usually a lot of patients I see are losing their dorsiflexion. Dorsiflexion is basically getting your foot to come up towards the body, as you can see on the video on the right. Two different exercises which I tend to give are knee to wall, which are great for more advanced kind of patients who have less pain to increase that range. And if you do have issues with that, you can start off with using a towel and again, engaging how much you pull back each time. You can again increase this throughout the whole period of your rehab to help again improve that dorsiflexion, as this movement is really key for getting you back to walking and running and also doing specific exercises in the gym in the long term. We've got here some calf raises. These can be performed seated and in standing, again, with or without the boot, potentially seated. As you can see in two videos in the middle, where the foot is pointing out and the foot is pointing in. Here, we're trying to target basically all the area of the muscle of the gastrocnemius and soleus, which are big calf muscles, very important for you regaining your walking ability and also helping you walking and running. So then we've got some resistant band exercises. These are very important, and we often kind of give these out as soon as possible to help strengthen the overall foot and ankle, working on all the muscles, again, all different angles, left, right, moving the foot up and down. And also you can do these holding a few seconds with some of the bands, or you can do them in repetitions, depending on how much you can do. Here we've got some of my favorite exercises, which are quite challenging for the foot and ankle. You've got the first two on the left, which are great to kind of really get your ankle moving in awkward positions. And the video on the right, really good for stretching the calf and also gaining more mobility as we go along. Here we're going to kind of finish off with focusing on some late stage exercises which will involve single leg balance work. Here we've got you moving out the ball away from the body, then bringing the balls in, working your proprioceptive side as well. There's so many more exercises that can be performed at this stage. So here we've got the back to running, main goal. So like we spoke about, we're going to start off with easy exercises, working up this ladder. And as we're working up this ladder, we want to make sure we're engaging each step with making it challenging. For example, when you're hopping, you want to start off with, say, double leg, then going into single leg exercises. When you're starting to jog, we want to start to also walk or jog. You want to start to walk on maybe some wet surfaces, smooth surfaces, or even changing the speed of how fast you step, and also how long in terms of how much you do that day. These will all help to gradually increase and get you ready to going back towards normal running or even sprinting. There we go. I hope that was good.
Brilliant. Thanks, Mehrdad.
Really helpful.
So our hope is that this short video will allow anyone who's been diagnosed with a stress fracture to understand a bit about what it is, why they've got it, and then give you an idea of how it's going to progress. And also following some of these exercises can help you to navigate through this difficult period whereby it's more difficult to get face-to-face consultations with doctors and physiotherapists. Obviously, if there's any issues during your recovery, you're able to contact us and we can help you either from the injury point of view or the recovery point of view. So thank you very much, Mehrdad.
No problem. Thank you both. This was a great presentation. I think it's a great introduction to the running injuries, as it's so common now.
Yeah, exactly.
There's so much more to talk about as well, so we try to keep it short and kind of to the point.
Yeah, exactly. Right. So thanks very much, Mehrdad.